Psychiatry Grand Rounds. If you are an attending medical student or resident who needs to check in for attendance or CME credit, the information is posted in the back of the auditorium. The Grand Rounds Committee requests that you silence your cell phones during the presentation and refrain from unnecessary use. This morning I have the pleasure of introducing Dr. John Hendrick. Dr. Hendrick is a professor of psychiatry at East Tennessee State University. He is the chief of psychiatry at the Mountain Home VA Medical Center in Johnson City, Tennessee, which is the second largest psychiatric group practice in Tennessee. He is a distinguished fellow of the American Psychiatric Association and a past president of the Tennessee Psychiatric Association. He has been named an outstanding teacher in the East Tennessee State University Psychiatry Residency Program and has received an Irma J. Bland Award for Excellence in Psychiatric Residency Education from the APA. He is the task director for neurosciences in the ETSU Department of Psychiatry Residency and the VA ETSU Liaison Coordinator for Psychiatric Education. He is the chair of the ETSU Department of Psychiatry Residency Curriculum Committee, and his expertise is in brain and behavior and the interaction of psychopharmacologic agents with specific neural circuitry. Please welcome Dr. Hendrick.
Thank you, Susie. So, like gravity in the physical world, consciousness continues apparently in perpetuity. And as far as we know, consciousness should, like gravity, continue in perpetuity until the heat death of the universe. So it's an interesting circumstance. The Big Bang occurs, and we're going to talk about that a little bit. And then over a period of eons, what happens is biology develops in such a way that life formats. We don't exactly know how, but in the most basic life forms, you could argue that consciousness doesn't really exist, that really it's just a biochemical format. But soon after the basic life forms have developed, consciousness then does come in some way into existence. And ever since the evolution of the very first vestiges of consciousness in biology, there's been a continuation. Now, for each individual, of course, your consciousness begins and will end. But consciousness as a phenomenon, consciousness as an archetype, will continue, as far as we know, as long as biology exists at this point in time. So, a feature of this is the brain knows and doesn't know certain things. It knows what to do with itself. It knows internally within itself how it works. It gets that, okay? But it doesn't understand certain things. Like, for instance, it doesn't understand that neurology looks at aspects of the brain on the one hand and psychiatry looks at aspects of the brain on a different format. It doesn't get that. It's just the brain. Dr. George Brown asked me an interesting question the other day. He said, I'm not sure I really heard the word instantiation before, and I'm not sure I know what it means. And so I started to talk a little bit about consciousness. And he said, yes, but there, are Freudian, Jungian concepts here. There's an unconscious mind and a preconscious mind. And as psychiatrists, we certainly not only believe that, we feel that we work with all of those features of brain on a regular basis. But that's why we need a word like instantiation. First of all, the root instant is very important because the time frames on which the brain actuates its activity are very, very brief. In most instances, the kind of time frame in neuronal action is generally something like 0.05 milliseconds. But this is not always true. So the brain has a physical structure, it has a temporal circumstance, a timing set on which it works, a chemical nature, and then an interactive, integrative function that makes this business of instantiation occur. So instantiation occurs not only for the conscious mind as we recognize it, but also for the lower levels of brain function that are unconscious or preconscious to human perception. So we need this word instantiation to talk about basically the biological drive within the brain that causes it to be functionally capacitated. And this functional capacitation is very closely related to the morphology of the anatomy of the brain, as I'm going to demonstrate. And another interesting idea about this is, if you think about psychopathology, if you think about schizophrenia or autism, if you think about bipolar disorders or major depression, in each instance, you can begin to get the idea that there are certain failures of the instantiation of what one might refer to as normal brain function. And it is that failure of the instantiation that in fact demonstrates itself as the syndrome that we might call major depression or chronic schizophrenia. So the brain is limited on a psychopathological basis for each of these kinds of things that psychiatry focuses on. Now, I guess I should put my disclaimer up and say that I'm employed at Mountain Home and have a contract with ETSU, but otherwise have no conflicts. And I don't think we'll be talking about commercial products unless there's some question, in which case I'll make a specific disclaimer. An instantiation often consists of reafferentation pathways in the brain. And I start with the lateral and medial limbic circuits because they're very interesting. This is how the brain reacts to the environment all the time. The lateral limbic circuits, the outer circuits, have to do with external perception of the world and our emotional response. So in other words, the lateral limbic circuit, for instance, monitors the outsides of the body, the outside edges of the body, and coordinates with the parietal lobe in this regard to understand the things that are happening immediately lateral to our physical self that may impact us emotionally. So for instance, you can imagine if somebody punches you in the nose, you're going to have an emotional response to that. Now the medial circuits, on the other hand, are very much intrapsychic. So these two circuits are right next to each other, but the medial ones are very much involved with coordinating subcortical activities of the brain that are generally unconscious with the nature of cognitive activity of the cortex that, on the other hand, is much more generally conscious. So what's going on is there are timing and electrical loops in the lateral limbic circuit that has to do with affective response to the environment, and then the same kinds of timed afferentation loops in the medial limbic circuit that has to do with intrapsychic experience. Now I mentioned that most of the time brain activity occurs excuse me, at about 0.5 milliseconds. However, that's not always true. These reafferentation pathways in our brains can sometimes set up for as much as 10 seconds in advance. This has been well shown ever since the 1960s. So the brain has certain buffer areas. The sixth layer of the cortex can buffer much information, including memory information. The hippocampus and other areas will receive information and then buffer it and store it there. So for instance, the motor planning areas of the frontal lobe can store information to plan for a motoric action that may be long down the timeline for when you're going to institute it. So for instance, I'm standing up here speaking with my hands, and the fact that I picked my left hand up to make that last point, I probably had programmed into my motor cortex long before I ever did it. I knew I would probably do it, and I'm holding the switcher in the other hand, so it just was in my head that I was going to do it. Now, I wasn't conscious of programming that way. It just happens. So this idea that these reafferentation pathways have very specific timing in terms of coordinating affect, emotion, cognition, all of these things are very important. Now, a neuron itself is very important in understanding and instantiation. And why is that? Well, here's this large neuron, okay? And all of these regions right here are basically the basic tenets of an analog computer. There are lots of them, and they're bulky. But right here at the axonal hillock, that's not analog, that's digital. The hillock is either going to fire or not fire, depending on how much analog information is distributed into this neuron. Then it'll either go 1 and fire or 0 and stay quiet. So first, the brain is an analog digital computer. Second, the brain is a liquid solid interface computer. Now when you look at this and you see the vascular tree in this plastination of the brain's vascular tree, you recognize not only is the brain a liquid solid interface computer because there is so much vascularity and blood present, but of course what you can't see here is the fluid in the synaptic space, okay? But all of those come into play very much in the computer nature of the brain. Now, I do a lot of ECT, and I teach a lot of medical students down in the ECT suite. They come down and help us with it, and many of the residents here have done the elective. Meanwhile, one of the questions I'll often get is, so ECT is like rebooting a computer. Well, in a way, yes, but the analogy breaks down because the computer itself can turn off. And then, when you've turned it off, you turn it back on, it resets its circuitry. It's very similar to what the brain is doing after ECT, but of course what we don't do in ECT is we don't turn the brain off. So if we do that, there's a very good chance we won't be able to turn it back on at all, so that would not be a good procedure. So what happens is we're firing, because of the electrical insult of the ECT, we're firing all the biogenic amines out of this liquid-solid interface into the periphery, and then the brain itself is using allostatic mechanisms to not reboot, but to reinstantiate its baseline functions, to put them back as they should be. So that's why we think that that is the case, that ECT can work. So, like my friend Dr. Einstein here, if you can't explain it simply enough, you don't understand it well enough, I'm going to hope to go ahead and confuse you a little further with this material. Now, many of you that have taken my courses know that this is Phineas Gage, and probably many people would know that anyway. Phineas Gage in 1848 had the unfortunate experience, that's a railroad tamping rod for moving railroad ties around. He was punching it down into a granite rock. There was TNT in the base of the hole there, and he clicked off a spark, blew that tamping rod through his orbit, kind of wasn't good for his eye, but he also gave himself a lobotomy. Now this was a left frontal lobotomy. Okay, it had a little bit of right component. And it was an interesting thing because in the 19th century, in 1848, people were not sure, not really sure, that mentation was in fact located in the brain. But after Gage's accident, which he survived, by the way, after his accident, it was very clear that mentation was located in the brain. Gage, however, was a very different person after this. He lost a lot of his frontal inhibition function. He cussed like a sailor. And his friends said after the accident, Gage was not Gage. Now, interestingly, he left us his skull with the defect that the tamping rod hit. You can see it in Cavendish, New Hampshire. And the thing about it is, now that we have the sophisticated level of connectomics that we have for the brain, we can actually take Gage's skull and we can make a connectome of the human brain, and look what's missing here, okay? Gage punched a big hole in his connectome. And so even though this accident happened, you know, 170 years ago, we can still use the information now using these modern sophisticated connectomic techniques to understand exactly what the nature of his brain damage was. So, and actually, I want you to remember this, okay? And remember this relative paucity of information transfer there, because I'm going to bring up a normal connectomic for you to compare in a little bit. Okay, so this issue of clubs and hubs has a lot to do with the nature of connectomics. This idea that there are rich clubs, areas in the brain where many neurons interact, and then smaller areas, hubs, where a lot of neurons bring information together, is a very important concept about how we use this information that we're gaining about how white matter tracks are structured and how they impact gray matter at neurotransmitter, at temporal, and at other chemical levels. So we'll come back to this. So by the 20th century, it was clear that the neocortex sat over top of the brain, and that partially conscious areas in the limbic system also existed, and that these areas sat on top of the diencephalon and the brainstem. So in many ways, you can look at the brain as a large inhibitory cortical mantle over top of the limbic system, the diencephalon, and the lower brainstem. Now, all of these areas of the brain have their own instantiations. They all have their own reafferentation pathways. They function in different ways. And you can think of this area as the primary process area. This is secondary process. This is tertiary process. And this is what Paul MacLean was referring to when he discussed the triune brain. So we see the brain here, and we see that when we use this idea, the cortex is tertiary, okay? Then limbic system regions, okay, are secondary. Then here we see the diencephalon and the brainstem, where largely unconscious functions of the brain exist. So these unconscious functions will drive upward into the limbic system, and from the limbic system, especially from this area of the cingulate gyrus, information pushes into the cortex. But then at the same time, the cortical information is coming down this way into the motor system. And those kinds of reafferentation pathways are the kinds of things that I'm talking about when I say anatomy instantiates function. So the brain's job is to deal with the environment. Okay, that's what it does. It's a transduction device that takes environmental material, puts it into primary sensory circumstances, then breaks that down into association zones of unimodal sensory information, recoordinates that into polymodal ideas and, well, not ideas, but circuitry, shifts that to the prefrontal region for various planning, and the premotor region in another portion of the frontal area, and then into motor responses that then interact back in the environment. So this is the transduction pathway that the brain uses between its anatomy, its functional capacity, and the nature of interaction with the environment. So the brain becomes like Schrodinger's cat, a black box. What happens is, you may remember from your basic physics, you take a black box, you open it up, and you put Schrodinger's cat in there. Well, you open it up at some later time, and Schrodinger's cat is either dead or alive. Depends on how much time has passed, in part. And it's kind of like that with the brain. We can't open it up and dissect it in the live state very effectively. We end up with gross outcomes. So the trick becomes, how can we look at the brain in such a way that it's no longer Schrodinger's cat, okay? And the way we do it is we use this connectome process. We get a brain, we get a piece of it, we cut it very thin, we image it, reconstruct that image in a computer graphic, and then we use further computer graphics to visualize and analyze this. Now, what are the problems with it? The problems are, can we look at it at the neural level, at the level of the neuron, and look at each of the synaptic connections? No, we don't have enough sophistication to do that yet. Can we look at the white matter tracks? Well, in the past 15 years, we've been able to do that much, much more effectively. And we've begun to understand that we've had this distinction between what the gray matter does and what the white matter does, but it's almost as artificial as the difference between neurology and psychiatry, because the brain just uses these circuits in afferentation pathways that reverberate in such a way as to cause instantiated brain activity. So we've gone from having to use gross brain to being able to acquire this information by MRI, by fMRI, and by a variety of other ways, including diffusion tensor imaging. And we've gotten to the part where we can then use MRIs, partition out the brain, and get very small portions. And we can actually begin to look at these connection networks with their clubs and hubs. And here's an example of, this is a owl monkey brain, but it's the first connectomic, full brain connectomic. And you can see how sophisticated these things have become. And they're increasingly sophisticated over this one, because this one was done quite long ago. Here's human brain, okay? And for one thing, in this brain, we can see a brain section here, so you get a better orientation. Right here, this red tract is the corpus callosum. This thick blue tract coming down here, corticospinal tracts. So you get a sense from diffusion MRI of exactly how we can begin to look at these connectomic circumstances. But at the neuronal level, especially at level 6, the outer cortical level of the brain, the neurons are very carefully intertwined. They are put down in a very specific pattern that is directed trophically in development by 3 interesting chemicals. Some of you may have heard of them: dopamine, norepinephrine, and serotonin. They are the trophic chemicals in development that cause the neurons to know how and where to migrate. Then later, they become controlling neurons, especially out of the limbic system, for brain function overall, though they are not the most ubiquitous neurotransmitters. The most ubiquitous are glutamine and GABA, much larger systems, but nonetheless still controlled by these smaller systems. But this neuronal pathway is very intricately defined. Now, the neuronal pathway is underlain by clubs and hubs. And so, for instance, right here, a very important junction portion in the brain where many, many, many neurons come together, this is the anterior nucleus of the thalamus. And those of you that have been in my residency training have heard me say this so many times, I'm surprised somebody hadn't thrown an eraser at me yet. Oh, that's right, I banned all the erasers from my talks. Anyway, all limbic system information goes to the anterior nucleus of the thalamus. With one exception, some limbic information goes to the mediodorsal nucleus, but I'm going to show you the thalamus in a little bit, and you'll see why that doesn't really become an exception. They're really very closely related. But the point is, normally we think about the thalamus as a somatosensory gating region of the brain, but in fact, beyond somatosensory gating, a very substantial portion of the thalamus gates affective, emotional information in the brain as well. And again, it integrates things together in the instantiation of function, and it does not draw a bright line between things like motor activity or cerebellar activity and emotional activity. It actually blends them together. So you may recall I said perceptual information comes in, it's broken into unimodal analysis, and then an afferentation pathway puts it into polymodal analysis. Very similar for the thalamus with affective information from the limbic system. I mentioned that I was going to show you a normal human connectome, and this is what Gage's connectome looked like before he fired a tamping rod through it. And it's what it should look like. Now, a few things that are interesting. The associative region okay, premotor, prefrontal, this associative region is hugely influential and very heavily connected to the parietal lobe. The brain is very visual, but from a connectomic point of view, only a little bit more than auditory. Now that's not what we normally think about, because if you think about blindfolding yourself and trying to walk through a day, you think how very hard that would be. On the other hand, if you stuck cotton balls in your ears and walked around for a day, it would be annoying, but it wouldn't be anywhere near as impairing. But the connectome doesn't recognize that difference exactly. Here's the cortex and the hippocampus, an interface between limbic and hippocampal regions with the cortex, also very heavily connected because memory transitions from the hippocampus into the cortex, and that's a very, very important feature of the brain. And finally, I want to refer to this. Many of you, especially that have heard my discussion on the limbic system itself, and some of the M3s that have heard my behavioral neuro, have seen my picture of the brain with a big portion of the temporal lobe missing and the insula showing through. The insula of the brain is a very large portion, and it is responsible for idiovisceromotor functions of brain activity. So frontal ideations transition into visceral phenomenon by way of the insula. And look how important that is as a portion of the connectome, okay? Because we don't often think about it. I can ask the greenest M1, what does the occipital lobe do? And they'll say vision. But I can ask very sophisticated brain folks sometimes, what does the insula do? And I get kind of this look like, something maybe has something to do with taste, which would be true as well, by the way. Now, these connectome studies have allowed us to actually take a hard look at the nature of evolution. We can use the connectomes to actually map our transition out of East Africa worldwide. And this is important to us because brain and evolution are closely coordinated. In evolution, when we see lower phylogenetic levels, we see brain like this, very smooth, very small, not a lot of white matter or synaptic connections compared to more sophisticated, higher level brains. And we get eventually to human brain, which probably is the most sophisticated brain. At least it's the most sophisticated brain for action in a terrestrial environment. Now, dolphins also, look at this. They're as gyrated, maybe more gyrated really than we are. They have a huge cerebellum. And interestingly, on either side, they're basically the same. Because for humans, there is a distinct advantage in a terrestrial environment over being, for most of us, for 85 or more %, being right-handed and being left-brained for verbal skills. That represents an advantage. For dolphins, though, they need to be able to protect themselves from attack from above or from below, from right, from left, from front or back. So they need a more symmetrical brain. They don't need the kinds of verbal skills with words that we use, though they do have a vocal communication capacity. But they don't need to specialize their brain on one side in order to do that. So while we may be the most heavily evolved terrestrial organism, dolphins may challenge us quite a bit. We would find ourselves out of place in a fully aqueous environment. So, the dinosaurs, on the other hand, are an interesting question. Were they conscious? Well, they probably were, but they probably had very, very primordial consciousness. So, here's the Big Bang, and we go along. I guess we could argue whether or not algae have consciousness, but I don't think anybody's going to argue real hard for that proposition. On the other hand, once we get to eukaryotes, the question of consciousness, at least in terms of response to perceptual phenomenon, becomes more interesting. And once we get past sponges and into the level of the Cambrian explosion here, about a half billion years ago, now we have animals that are clearly conscious. So dinosaurs, you can probably argue, needed to have at least basic consciousness because of their large size. They wouldn't have been able to work in the world without some basic consciousness. But their consciousness was not like that allowed humans here somewhere around 250,000 years ago to develop an awareness of how important language was. Now, 250,000 years ago, even then, language was important but primordial. But by 50,000 years ago, language had become really quite sophisticated, and the blending of the use of tools and language certainly required consciousness, conscious inventing, and also pedagogy, teaching others how to do those things. So I think that we would certainly, by the time Homo sapiens is at the language level, we would argue clearly human consciousness very definitively exists. Now, how does it exist? Well, we have this idea. Remember, I told you that each neuron has an axon hillock, and it is a digital computer. It either fires or it doesn't, depending on how much stimulation it gets. Well, the neuron is more complicated. Inside the neuron are these microtubules. And at the junction at each one of these proteinaceous microtubules, there exists a connection, one protein to another, and that connection at any given instant in time, quantum instant in time, is in some position. So this connector might be in the cis position, this might be in the trans. You can consider this trans, cis. And meanwhile, in some instantaneous moment in time, that transition from the qubit position to its alternative for all of the qubits that exist in all of the microtubules that exist in all of the neurons that exist in human brain. That number is in fact large enough that we think this qubit proposition can probably be large enough to explain at a quantum mechanical level how the brain works. We think that it probably is going to take a sophisticated theory such as quantum mechanics to explain what happens in consciousness. How is instantiation of the brain translated into consciousness? So I was in Kentucky, and the chair at University of Kentucky asked me an interesting question. Well, the problem with that idea is you can't prove it because there's no way to get to the null hypothesis. He's right about that. But there may come a time when computer sophistication will be great enough. Already we think we may be getting to the place where computer sophistication is great enough to look at synaptic connections and actually see them. Will we eventually be able to get to the point where a quantum computer would be able to analyze the quantum nature of this system? I don't know. Maybe. It is a very tough question, though, and it's beyond our technology currently. But one thing that we do know, even if quantum mechanics is what's causing consciousness, the experiences that we have in consciousness do modify brain cell connections. So brain synapses either grow or retract depending on experience. This is the nature of long-term potentiation. The hippocampus can be very involved in this, and the transition of memory from the hippocampus into layer 6 of the cortex is very involved in this kind of synaptic remapping. And that means that experience modifies brain cell connections and allows for increasing capacities in consciousness. This is a good reason to just stay in educating yourself all the time, because you'll get better for it. Now, I've made the point about consciousness in dolphins and humans, and I made the point about, you know, were dinosaurs really conscious, and we probably decided that algae are not, okay? So what's the difference? Well, the question becomes, how many neurons have to occur? How complex does the system have to be to define what consciousness is? Well, it probably has to be at least at the level of eukaryotes, and it has to be very complex. Until it gets at a certain complexity, it really isn't consciousness. Now, where we are right now is, here is the input from our perceptual systems. We don't understand this level of connectivity. We do understand the output level, which is in some ways simpler. But when you look at the math of it, here's the input again. This is upside down from the other side. Here's the input. Look how complicated these weighted connections become. Then the hidden units, these are neurons and neuron networks that are either firing or not firing. And then it becomes simpler, the math becomes simpler when we go from the hidden layer here. We still are struggling to understand this, and mechanisms that we're using to do it include the fact that we know such things as, in the thalamus, for instance, we know that layer 4 of the cortex is the thalamic inbox, layer 6, the thalamic outbox. So thalamic sensory-gated information is going to level 4. It's being coordinated through level 5. Layer 6 is feeding back to the thalamus. So we know patterns like that. We know greater, larger network patterns, okay? And here you can see the frontal lobe, the parietal lobe, the temporal lobe. And by the way, the temporal lobe here blends into the occipital lobe because so much of the temporal lobe is visual in its nature. How does this all become consciousness? Interestingly, there are these areas in the brain, a little area right here between the external and the extreme capsule. You see a little black kind of a reverse S shape there, called the claustrum. Now the claustrum is fed information from the interlaminar nuclei of the thalamus and distributes that information throughout the cortex. As a matter of fact, the Allen Brain Institute has recently found there may be as few as 3 neurons coming out of each claustrum on either side that may connect essentially to the entire cortical mantle. Well, if that's true, and it's looking like it may be, this may be a level that we can look at the instantiation of what's going on with those specific neurons to gain much more information than we can by kind of taking it down to look at neuron by neuron through the brain. Now, here's something about perception, okay? I think everybody sees a person walking. Anybody that doesn't see that, raise their hand, please. Now, I've got another idea about this. Please raise your hand if you think this is a man walking. No, come on, raise your hand if you think it's a man walking. Does that look like a woman walking? That's a man walking, okay? Now, why do we think that? Because after all, okay, what this is a series of random dots moving against a white screen, okay? That's all it is. But the perception that it is a man walking is there. Well, that's because our frontal cortex is putting information into our cognitive, limbic, and when I finally got you to raise your hands, motor loops, okay, it's putting that information in and it's driving that. Now, one of the things that goes on when you see something like that, if I go back to it, you know, is this a man walking with dangerous intent? Nobody has an opinion on that, right? I mean, you can't tell. So in this case, the amygdala, looking for fear-threat information and going directly to the limbic with that, is not involved, okay? But the orbitofrontal cortex is analyzing the motion that we saw and perceiving it as walking. Okay? So there are a variety of subcortical areas that are very closely connected to analyzing the affective components of what's going on in the perceptual world. The nucleus accumbens sits right in the middle of this. The amygdala is feeding information to it. The ventral tegmental area and dopamine are coming in here. The ventral pallidum, many of you will remember that's the bottom third of the globus pallidus interna and externa, one of the oldest emotional processing centers of the brain. And a baby is born. And the medial dorsal thalamus, which I pointed out is right next to the anterior nucleus of the thalamus, All of these are subcortical regions that instantiate and apply limbic information into the cognitive loop. So this information gets into the cognitive loop, and from there, this coordinated information gets into the motor loop for goal-directed action. So the cortex itself is driven, and you'll notice here, anterior nuclei of the thalamus, anterior nuclei, mediodorsal. So limbic information is largely into the mediodorsal, but the prefrontal loop, one that we haven't discussed much, the oculomotor loop, where you position your eyes in space, and the motor loop in general, where you put your body, your limbs, okay, all of these things are being driven by this thalamic innervation. It's going to the ventral pallidum, the globus pallidus. It's going then into the larger basal ganglia, and that's connecting with cortex. Now you'll notice that the cortex drives information down these pathways. It doesn't go bidirectionally, it goes down. Cortex drives information into the basal ganglia, descending. The thalamus, on the other hand, has information going into the cortex and coming back to the thalamus. So the thalamus is bidirectional. The basal ganglia relationship to the cortex is basically descending, with the exception of the head of the caudate, which is buried here, has bidirectional information to the frontal cortex for a very specific reason, but that's for a different lecture. The autonomic nervous system is maybe the oldest portion of the limbic system. It's very connected, it has many different neurotransmitters, things like BDNF, okay, neuropeptide Y. It's very connected to the afferent vagus area. This is the nucleus solitarius, okay. It's very connected because at the lower levels of consciousness, the connections of perceptual systems and fear threat into gut reaction, very important. In order to digest well, you have to be relaxed. If you're in a stage of fight or flight, you can't relax and digest. So this is very old evolutionary material. Here we see the basal ganglia and its connection to the thalamus. Here we notice the anterior and ventral anterior thalamus, and here we see the dorsomedial nucleus. So we think of the thalamus in here as a gating area. These areas are, for instance, gating pain from the body and the face. This is gating vision. This is gating vision. But almost, probably 40%, maybe even 50% of the thalamus is gating affective information from all of these cortical regions. Okay? Here's the hypothalamus sending information into that anterior nucleus. Again, limbic information coming into the thalamus. Now there are other subcortical regions, such as the extended amygdala. The amygdala initially looks at the world to decipher threat, but then quickly places other perceptual values in place to decide whether that threat exists or not. So I said this one day this year to one of the residents who said, so like when the brain perceives other as opposed to us, okay, it reacts in a guarded way. And the resident said, so you're telling me the brain is intrinsically racist? No, it isn't. However, it is intrinsically tribal. It recognizes us initially, but very quickly then, with interpersonal interaction and knowing the other person, the cognitive loop changes that initial reaction of, I don't know who this is, and I don't know whether they're a danger to me or not. It rapidly changes then into a, oh, this is a person I get along with very well. Now, you know, if they draw a big 12-inch knife out of their boot and threaten you, maybe it reacts a different way. But if they just react in a normal way, then things like this, the extended amygdala, begins to incorporate frontal cognitive aspects into the instantiation of brain assessment of function. So we see here then the extended amygdala and its connection to the ventral tegmental region, dopamine, you remember. Here we see the ventral pallidum again. We see the nucleus accumbens sitting right in the middle of this. Okay, there's our thalamus connection with emotional information. There's the prefrontal cortex pushing that information in. And again, you see it here. Diencephalon, here's the prefrontal cortex, cingulate gyrus, very important portion of the limbic system. Many people kind of forget about the septal area. The septal area is responsible for turning off the fear threat assessment coming from the amygdala. The frontal cortex itself recognizes self and decides what that means. It places salience and gates the salience of perceptual information into the afferentation pathways of the brain. And then things like the limbic system, nucleus accumbens, assess reward systems. Again, anterior thalamic nuclei, all limbic information going in there. Here we see some connectomics, superior longitudinal fasciculus, corticospinal, arcuate fasciculus, uncinate fasciculus. This is the kind of information that connectomics are giving us a lot of information on. We can tell how coherent these connections are at either end to get an idea of function. That's the kind of thing Lichtman's doing. And then these pathways also get into very basic phenomenon, such as analyzing human gaze, okay? I think I saw Dr. Hugh walk in the other day. He was sitting in lecture. I stopped talking. He was doing something on his computer. I stopped talking. I stared at him until he finally looked up and he says, "Dr. Hendrick, you're creeping me out." And it was right. I did it very much on purpose, okay? And he was exactly right. He could feel that I was just glaring at him. And I did it to make the proposition. He didn't really have a way to perceive it. He wasn't looking at me. But nonetheless, he had this unconscious perception that I was glaring at him, and he knew that it was happening. And it's an important thing. This gaze center information is very involved in these reafferent pathways from the frontal lobe. Many people are very well aware when somebody is staring at them. They'll turn and look because they can just tell that it's happening. So that kind of thing gets into theory of mind, where we understand that our actions integrate with the actions of others, their actions integrate with us, and the two things go back and forth. This is a brain instantiation. Now, this is the arcuate fasciculus. This is the verbal area of the brain, very important. To give you an idea of what happens that breaks instantiation, well, I'm sorry, this is how complicated the instantiation of the verbal region can be all over the brain. We've got reading words, hearing words, saying words, thinking about words. But if you get a brain lesion like this is a big Wernicke stroke, okay? That area of brain no longer is able to instantiate, okay? It's just not able to. There's an infarction there that's not able to be repaired. So the connectome is really helping us to understand these large white matter tracting information processing circumstances from the neuronal level into the integrated regional level. Okay? Again, perceptions are odd. What do you see here? I get different answers, 3 Pac-Men. I also get what most people see, the triangle. Well, what you really see are 3 shapes that define a triangle. But the reafferentation loops of your brain turn it into either Pac-Man or a triangle. These reafferentation loops are different on the right side of the brain from the left side. The left side is about verbal information. The right side is much more about emotional circumstance and processing the gestalt of the world. The parietal lobe has a very specific associational capacity, especially on the right side. We have this tendency to see human faces in clouds, in almost anything, okay? I think we all can agree that's not a human face, but it sure kind of does look like one. So the brain is very formatted to look at human faces and immediately assess their emotional impact. Are they dangerous? Are they kind? Are they friendly? Are they part of us? Are they new to us? That's a very important feature. And if we can't see a human face, if we have a problem with prosopagnosia, okay, a right parietal issue, then, you know, it would be very hard to read the emotion on this woman's face in the bottom perspective. So these reentrant loops exist all over the brain. They move unconscious, preconscious, and conscious information from region to region. They use the white matter tracks to do it very effectively. They also use specific individual neurons called bipolar neurons, von Economo neurons, to move information very specifically from one place to another. This helps us to integrate theory of mind from associational regions in the parietal lobe to the frontal lobe. It helps us to understand how the brain puts saliency, or how it can fall into its default mode. Default mode is what your brain would be doing if you were laying quietly with your eyes closed, thinking of nothing. It's beginning to help us understand things like depression. So the ventral striatum, and I've quizzed many of you on the components of the ventral striatum, the ventral pallidum, their connection to the prefrontal cortex and the mediodorsal thalamus. These are loops that we can begin to look at very specifically in specific areas like depression. We're looking at the hypothalamic nuclei. It's very interesting because one of the things it will allow is right now in fat rats. You guys have all seen where hypothalamic rats have blown up to be very obese. We can go in, we can cannulate the lateral hypothalamus, we can put blue-green algae DNA in there, we can leave behind a blue cannula, and when the rat gets hungry, we can turn the blue light on, and the rat will feel sated even though it doesn't eat, and it'll shrink back down to its normal size. Now, information like that is the kind of thing we can use this for, and this optogenetics thing is an oncoming field of real importance. Much of this is driven by the genetics of the brain. So any brain's instantiation is going to a certain extent to be limited by the genetic display that occurs there. And we don't have time in this lecture to get into that in depth, but it's a very important piece of this. So some of these patterns are important. Here you see a neuron, and here you see another neuron. Oh, not another neuron. Anybody know what this measurement is? Light years. That's a neuron. This is the universe. Okay? These patterns exist in nature, and they are very important. So as I started with, gravity in perpetuity, consciousness in perpetuity as far as we know. So thank goodness for our limbic lobe. It allows us to put affective information in with cognitive information. It drives our behavior. And I'm going to finish with Emily Dickinson and her comment. Thank you very much. Any questions? Yeah, Tony.
By the way, just to reinforce, didn't want to enforce the creepiness factor. That was definitely not.
Oh, I thought it was the perfect comment. I loved it when you said that. I was trying to creep you out. It worked out perfectly.
I had a question about the optogenetics. I think I read a paper that was saying how some of the studies were kind of elaborating on the role of being able to shut off what they call engrams, which are memories, which they're trying to say, in invertebrates. For example, they're saying that through patterns of behavior with invertebrates, they're able to kind of make these memory tracks, and when they shut it off with the optogenetics, that obviously there's a complete remission in this kind of behavior. Do you see something like that in terms of how
Yes, I do see something like that, but when it advances to human levels is hard to say. So, for instance, I've seen similar things. They actually are at a place where they can track some of these reentrant loops, or reafferentation loops is what I ought to call them, in rat brain. And they can track those and can do the same kind of thing, can shut off those things. They can do, like for instance, they can do maze learning, track the reafferentation loop, and then destroy the maze learning by using optogenetic intervention. But it's one thing to go in and destroy a meme or an engram or a known pattern, a long-term potentiated reafferentation pathway. It's another thing to do something productive with it. But you got to start somewhere. So I think that I think this is coming. I doubt if optogenetics is going to be a part of my career in terms of human medicine. Might be a part of your career. I wouldn't be surprised by that. But it is a very interesting field. It's something we probably ought to have a grand rounds on sometime in the near future, because it is really amazing the stuff they're doing right now. But it's not much at the human level that I'm aware of. Carl.
John, you took a very neuroanatomical approach to consciousness. What do you think about the importance of a pathophysiological approach, looking at disorders that affect consciousness, like coma, vegetative states, and how they can inform us about understanding consciousness better?
Yeah, actually, the main thrust of information in trying to understand consciousness in the scientific community right now is looking at the exact question of what are the minimal correlates of consciousness. So things like persistent vegetative state and coma, these kinds of things, even stupor for that matter, all of these things shed light on how much brain instantiation does need to occur in order for consciousness to occur. Just recently, some of the residents and I were doing some Kaufman's questions on persistent vegetative state versus coma, that kind of thing. And it is an interesting question. How much brain do you need? One of the slides that I didn't include, I have a slide of a famous situation called Mike the Headless Chicken. And Mike got his head chopped off, but he didn't die. And a little piece of his superior temporal sulcus was left, and he walked around for 18 months. And somebody fed this chicken for 18 months with its head off. So, you know, the question is, how much brain activity do you have to have instantiated to allow consciousness to occur? Well, is a walking chicken body a consciousness? It's hard to say. It did walk for 18 months, okay, with very, very minimal portion of brain. So these questions are very unclear. It's one of the reasons that we're interested in brain evolution and trying to know more about it, because the question of when did consciousness actually occur, it's very hard to say, because we still don't have a good definition of what it is, nor do we have an idea of what it minimally needs to be. But this idea of an instantiation of the brain, a biological driving force that allows the brain to function in such a way, anatomically and functionally, such that consciousness then can drive behavior. Very interesting question. And I think, I really do believe that we need to kind of understand that most psychopathological conditions are, at relative levels, impairments of the best consciousness that each human should be able to have. And of course, one of the things we try and do therapeutically as psychiatrists is restore that capacity to individuals to the best of our ability. Admittedly, we have some kind of ham-handed tools, but nonetheless, we're getting better at it all the time. Thank you all.